Hi friends, welcome to the channel. After a long time, we are restarting our MCQ videos. So today we are discussing about ophthalmology MCQs with the rationales. Ophthalmology means related to eyes. So we will go to our topic. Before that, if you are not subscribed to our channel, please subscribe. We will upload video in coming days continuously. So we will move to the topic ophthalmology MCQs with the rationales. First question. Which of the following is the most common cause of blindness worldwide? So it is an easy question. As you know, which one is correct answer? Please comment here. So options are cataract, glaucoma, diabetic retinopathy, age-related macular degeneration, or ARMD. Correct answer is cataract. Cataract is the most common cause of blindness worldwide. So usually, if it is untreated, cataract will leads to blindness. Cataracts are the leading cause of the blindness globally, particularly in low and middle income countries due to inadequate access to surgery. So with the surgery, we can prevent the blindness. So if it is not doing on time, cataract will leads to blindness, permanent blindness. Cataract results from protein clumping in the lens, leading to clouding and finally vision loss. Second question, a 45-year-old patient presents with peripheral vision loss. What is the most likely diagnosis? It is a common question in each government examination. So here options are glaucoma, retinal detachment, cataract, macular degenerations. So correct answer, glaucoma. Glaucoma is often characterized by progressive peripheral vision loss due to increased intraocular pressure, which damages the optic nerve. So due to increased intraocular pressure, it will leads to damage to the optic nerve. So that will leads to vision loss. Central vision is usually affected later in the disease process. So first symptom affected on the peripheral vision loss, and fine in the fine end stage only central vision will be loss. Next question. Which test is commonly used to diagnose as a corneal abrasion? Corneal abrasion is usually it is difficult to diagnose. So in that cases, which diagnostic measures used to find it? Options: fluorescein staining, fundoscopy, tonometry, visual field test. So here correct answer is fluorescein staining. Fluorescent staining. So after some putting some fluorescent stain into eyes, the doctor will light with the blue light. So we can easily diagnose the injury or the abrasion. We can see it as a green color. So first we will doctor will put a fluorescent stain over the eyes and then light with the blue color. Then the abrasion will be seen as a green mark. Fluorescent staining is a diagnostic test where a fluorescent dye is applied to the eye. Under blue light, corneal abrasions appear as bright green areas, helping to localize the defect. Next question. A patient reports seeing floaters and flashes of the light followed by a curtain-like shadow over their vision. Which is the most likely condition? Retinal detachment, cataract, conjunctivitis, glaucoma. So floaters and flashes of light usually seen in the condition of retinal detachment. Retinal detachment typically presents with the symptoms like floaters, flashes of light, and sudden curtain-like shadows uh, uh, seen in retinal detachment. Immediate treatment is crucial to prevent permanent vision loss. If it is not treated, the patient will lose his vision. So retinal detachment also need immediate treatment. Fifth question, which of the following is a key risk factor for age-related macular degeneration or AMD, age-related macular degeneration? Smoking, high myopia, use of contact lenses, viral infections. Correct answer is smoking. Smoking is a major risk factor for AMD or age-related macular degeneration. Smoking is a major modifiable risk factor for AMD as it accelerates oxidative damage to the retina. So can you explain what is modifiable risk factor in comment? So other risk factor for AMD, that is age-related macular degeneration, includes aging. I already explained. Smoking already explained. Other thing is aging, family history, and poor diet. These are the major risk factors for age-related macular dystrophy. Sixth question. A 10-year-old child complains of itchy eyes, redness, and watery discharges bilaterally. What is the most common, most probable diagnosis? Allergic conjunctivitis, bacterial conjunctivitis, glaucoma, cataract. So most possible diagnosis will be allergic conjunctivitis. In allergic conjunctivitis, most common symptoms include itchy eyes, redness, and watery discharges bilaterally. Allergic conjunctivitis commonly presents with bilateral itching, redness, and watery discharges, especially in younger individuals, and is triggered by allergens like pollen or dust. So due to long drive or playing outside, the allergens or pollen came into eyes. So that will lead to allergic conjunctivitis. Particularly, the child is allergic towards the pollen or dust. What is the hallmark finding in diabetic retinopathy on fundoscopy? Microaneurysm, cup to disc ratio changes, optic nerve atrophy, Dressen deposits. In diabetic retinopathy, the hallmark findings, that is microaneurysms. So small microaneurysm can be seen in fundoscopy. Cup to disc ratio changes usually seen in open angle glaucoma or normal tension glaucoma. Same time, optic nerve atrophy that can be seen in, that also seen in glaucoma end stage glaucoma. We can see optic nerve atrophy or sometimes multiple sclerosis or syphilis condition also we can see optic nerve atrophy. Dressen deposits that is usually seen in age-related macular degeneration or optic nerve head Dressen. In that condition also optic Dressen deposit can be seen. Another condition is familial Dressen. In that condition also Dressen deposit is the major symptom that can be diagnosed during fundoscopy. Microaneurysms are the earliest clinical sign of diabetic retinopathy resulting from damage to the retinal blood vessels. So retinal blood vessels will be damaged during the diabetic retinopathy, that will lead to microaneurysms. Small bleeding spot will be seen in diabetic retinopathy. Other findings can be seen in diabetic retinopathy include hemorrhages, exudates, and neurovascularization or neovascularization. So these are the other symptoms seen in diabetic retinopathy. Major or hallmark symptom that can be seen in fundoscopy, that is microaneurysm. Eighth question, which condition is characterized by abnormal inward turning of the eyelid leading to irritation of the cornea? Entropion, ectropion, ptosis, blepharitis. So here correct answer is entropion. Entropion means inward turning of the eyelid. Ectropion means outward turning. And ptosis, as you know, it is a dropping of upper eyelid. Blepharitis is the inflammation of the eyelids. Entropion is an inward turning of the eyelid causing eyelashes to rub against the cornea. So after turning of the eyelid into inward, that eyelash will cause irritation to the cornea. So that will lead to irritation and discomfort to the persons. Usually it is seen in age-related changes or due to scarring. These are the common causes for entropion. Often age-related or due to scarring. Ninth question, a patient presents with sudden painless loss of vision in one eye Fundoscopy shows a pale retina and a cherry red spot at the macula. What is the most likely diagnosis? Central retinal artery occlusion or CRAO, retinal vein occlusion, optic neuritis, cataract. Correct answer is central retinal artery occlusions. In that condition, there will be sudden painless loss of vision in one eye. Fundoscopy shows a pale retina and a cherry red spot at the macula. Pale retina usually because of the blood supply is occluded with some thrombosis or something. So that condition is known as central retinal artery occlusion. Central retinal artery occlusion is a medical emergency characterized by sudden painless monocular vision loss and typical fundoscopy findings of a pale retina with a cherry red spot due to retinal ischemia. So in another condition, there will be painless vision loss. Can you comment it below? Painless vision loss using some another condition. Which is the most appropriate initial treatment for acute angle closure glaucoma? Acute angle closure glaucoma is a emergency condition. In that condition, which medical treatment is required? Timolol eye drops, systemic steroids, antihistamines, artificial tears. So here timolol eye drops is used in the initial treatment for acute angle closure glaucoma. If it is untreated, it will lead to vision loss. That is why it requires emergency treatment. Acute angle closure glaucoma requires immediate treatment to reduce intraocular pressure. Timolol, that is a beta blocker, is commonly used as it decreases aqueous humor production. So usually glaucoma is due to increased intraocular pressure. So intraocular pressure is due to that is mainly due to increased uh, uh, production of aqueous humor or decreased absorption. So timolol will reduce the production of the aqueous humor. So that will leads to that will leads to the decrease of IOP. 11th question. A patient presents with a history of eye pain, photophobia and redness. Slit lamp examination reveals a dendritic corneal ulcer. What is the most likely diagnosis? Herpes simplex keratitis, bacterial conjunctivitis, fungal keratitis, corneal abrasion. Correct answer here, herpes simplex keratitis. So in the case of history of eye pain, photophobia and redness, slit lamp examination reveals dendritic corneal ulcer. That will leads to that is a findings of herpes simplex keratitis. Herpes simplex keratitis is caused by the herpes simplex virus and is characterized by dendritic. Dendritic means branch-like corneal ulcers seen on the slit lamp examinations. If you are visiting the ophthalmologist, that doctor will do slit lamp examinations. During the examination, the doctor can find it out the dendritic corneal ulcers. That is a characteristic features of herpes simplex keratitis. Antiviral therapy is required for management because the condition is caused by herpes simplex virus. So antiviral therapy is required. 12th question. What is the most common presenting symptom of dry eye syndrome? Foreign body sensation, severe pain, loss of central vision, eyelid swelling. Correct answer here, foreign body sensation. The most common presenting symptom of dry eye syndrome, that is foreign body sensation. Dry eye syndrome typically presents with a gritty or foreign body sensation, dryness and burning sensation. These are the symptoms of dry eye syndrome. It results from reduced tear production or sometimes increased tear evaporation. These are the two main reason for dry eye syndrome, that is reduced tear production or increased tear evaporation. So can you comment which gland is produced tear? The secretion tear is produced by which gland? Can you comment it below? Okay, next question. What is the first line medication for reducing intraocular pressure in open angle glaucoma? Antibiotic, corticosteroid eye drops, prostaglandin analogs, antihistamines. So here correct answer is prostaglandin analogs. So if you know the anatomy of the eyes, you can easily understand the prostaglandin analogs, how it is working to reduce the intraocular pressure in open angle glaucoma. Prostaglandin analogs like latanoprost are the first line treatment for open angle glaucoma. So how it is works means it increases the outflow of aqueous humor, effectively lowering intraocular pressure. So it will fasten the outflow of aqueous humor. So that will reduces the amount of aqueous humor and that eventually leads to reduce the intraocular pressure. Next question. Which of the following is the characteristic findings of hypertensive retinopathy? Cherry red spot, Drusen deposits, optic disc cupping, and arteriovenous nicking. Characteristic finding of hypertensive retinopathy, that is arteriovenous nicking. Arteriovenous nicking is also known as AV nicking. It is a phenomenon observed during an eye examinations. It occurs when a small artery or it is called arteriole crosses over a small vein, that is venule, compressing the vein and causing it to bulge on and either side of the crossing. This creates a hourglass-like appearance in the vein. It is often associated with hypertensive retinopathy, a condition caused by high blood pressure. So I can show here like usually an artery crossing the vein. So this is a normal crossing process. In arteriovenous AV nicking, so this is the vein. It is compressed with the arterioles. It will lead to the vein like hourglass structure. So this is known as arteriovenous nicking. Normally, it should not affect the vein while crossing, but in arteriovenous nicking phenomenon, the arterioles compresses the vein and which leads to the nicking, or it compress the venous junction, and it will leads to the flow of the blood through the vein. Hypertensive retinopathy is marked by AV nicking, where arterioles compress veins at crossing points, along with other signs like flame-shaped hemorrhages and cotton wool spots. So these are the important thing: flame-shaped hemorrhages and cotton wool spots plus AV nicking. These are the main symptoms that can be seen in hypertensive retinopathy: AV nicking, flame-shaped hemorrhages, cotton wool spots. Which refractive error is corrected by convex lenses? Myopia, hyperopia, astigmatism, presbyopia. Correct answer is hyperopia. Hyperopia or long-sightedness is corrected by convex lens. So this is the convex lens. So that will correct the focus points in the case of hyperopia. In the same time, myopia is corrected by concave lens, and presbyopia, astigmatism is corrected with a cylindrical lens. Convex lenses are used to correct hyperopia or far-sightedness or long-sightedness, where the eye's focal points lies behind the retina due to a short eyeball or reduced lens curvature. Then 16th question. A 60-year-old patient complains of halos around the light, blurred vision, and eye pain. Examination reveals a hazy cornea and mild dilated pupil. What is the most likely condition? Cataract, open angle glaucoma, acute angle closure glaucoma, retinitis pigmentosa. The correct answer here, acute angle closure glaucoma. Acute angle closure glaucoma presents with halos, blurred vision, eye pain, and systemic symptoms like nausea. It is known as an ophthalmic emergency requiring immediate reduction of intraocular pressure. For that, we can use mannitol like medicines to reduce intraocular pressure. What is the key features of keratoconus observed on corneal topography? Topography means that is a study of the structure. So options are cone-shaped cornea, irregular pupil, increased intraocular pressure, visualized cornea. So here is the example of normal cornea. So normal cornea will be, it is a curved structure. In keratoconic cornea, there will be a triangle-like cornea. So that is known as cone-shaped cornea. Cone-shaped cornea is the key feature of keratoconus condition. Keratoconus is characterized by progressive thinning and cone-like protrusion of the cornea, leading to irregular astigmatism and visual impairment. Corneal topography helps to confirm the diagnosis. 18th question. Which vitamin deficiency is associated with xerophthalmia and night blindness? It is the easiest question in this session. Correct option is vitamin A, vitamin B12, vitamin C, vitamin D. The correct answer is vitamin A. Vitamin A deficiency leads to xerophthalmia, that is dryness of the conjunctiva and cornea, and night blindness due to impaired rhodopsin production in retinal rods. Supplementation of vitamin A is a crucial in treatment. So vitamin A usually given along with our immunization schedule. So can you tell from where vitamin A supplementation started, in which month, and what dose vitamin A supplement is usually given? 19th question. A child presents with a white pupillary reflex or leukocoria in photographs. So this is an example. What is the most likely diagnosis? Retinal detachment, cataract, glaucoma, retinoblastoma. Correct answer is retinoblastoma. In retinoblastoma, we can see a white pupillary reflex or leukocoria in photographs. Leukocoria is a classic sign of retinoblastoma, a malignant tumor of the retina in children. It requires urgent evaluation and management to prevent metastasis and preserve vision. Last question. Which of the following is a common complication of untreated pterygium? Corneal astigmatism, retinal detachment, glaucoma, macular degeneration. Correct answer is corneal astigmatism. In corneal astigmatism is a common complication of untreated pterygium. Pterygium, a fibrovascular growth on the conjunctiva, can induce corneal astigmatism by pulling on the corneal surface. Severe cases may require surgical excision. So that is about today's video. Thank you for watching this video, and please like and share with your friends. And don't forget to subscribe our channel, The Nurse. Thank you.